Hi, Mr. Orange. How are you doing? I'm John Burns. I'm going to be your nurse today. I'm going to hand hygiene in real quick, and then I'm going to verify your name and date of birth. Is Mr. Orange 1724? Okay, thank you, Mr. Orange. So I'm going to ask the faculty about the blood glucose level, all right? And now I'm going to check the MAR real quick for your order. 5 units of insulin at 3 p.m. with the doctor's signature for Mr. Orange subcutaneously regular insulin. Okay, cool. So I'm going to hand hygiene again. I'm going to gather all my supplies. All right, I have all my supplies here. Regular insulin. I'm going to clean the top of the insulin with the alcohol prep. I'm going to open the needle. I'm going to instill 5 units of air in here. I'm going to insert the needle. And I'm going to push that 5 units of air in there. I'm going to put the needle upright. I'm going to withdraw 5 units of insulin. 5 units of insulin. I'm going to remove the needle. Alright, the needle has been removed. I am now going to recap with using the scoop method, because this is a clean, unused needle. And I'll put that to the side, and then I will check everything again. Alright, this is 5 units of insulin, regular insulin for Mr. Orange. And I check your armband again, and it's 5 units of insulin subcutaneously at 3 p.m. It's 3 p.m. with the doctor's signature for the Mr. Orange with a regular 5 units of insulin. So I'll hand hygiene again. I will don my gloves. I will choose a spot. We're going to choose your abdomen, but not too close to the belly button, Mr. Orange, for your subcutaneous injection. Alright, I've cleaned it with the alcohol prep in a circular motion. I will now uncap the needle, and I'm going to inject you now, Mr. Orange. Okay, you ready? Alright, here we go. So I'm going to inject Mr. Orange, and I'm going to push in my 5 units of insulin, and we are holding the spot if we need to, and then remove the needle and dispose of it in the sharps container. So I said dispose of it in the sharps container, but there's no sharps container in this house or area, so, and this is just being used on an orange, not an actual person. So for the sake of the video, I'm going to scoop method this needle back onto the cap, but we never recap used needles. We always put them in the sharps bin without recapping them. And we would also have to put the safety on, but I'm going to keep the safety so I can use this needle for practice. Alright, now I'm going to apply pressure with the alcohol prep if I need to, and then I'm going to remove my gloves, hand hygiene, and before we even injected him, I was supposed to ask for allergies. So you want to make sure they don't have any allergies to insulin or any reactions before. So ask them for allergies. No, you don't have any allergies. So that was supposed to happen prior to injection of insulin. And so now that we've done that, we can clean up the environment by putting everything away. We can lower the bed, and then to go over the intramuscular injection sites, we would have the deltoid and the ventrogluteal as the intramuscular injection sites at a 90-degree angle. And to use the Z-track method, I can demonstrate that real quick. We would have our needle, and we would pull the skin taut and down and away. We would inject the needle. We would slowly push the fluid into, we would inject the fluid slowly, and then hold it in there for about 10 seconds, and then remove the needle first before removing your hands, and then remove your hands. And then always throwing away the used needles in the sharps bin, but for the sake of the video, for practice, I'm going to keep this, and you would also put the safety on as well. So now that we have done that, we have gone over all of the information for the injection of a subcutaneous 5 insulin units for Mr. Orange.